Hi guys, Dr. Qureshi here. Today I have my lovely patient here. Say hello.
Hello.
And today we're going to talk about this condition which is known as Demodex blepharitis. So if you look here, this is the eyelashes when the patients have mites in them. So if you focus here, you see these little crusting here. That is known as the Demodex mite. Basically, it's a parasite living in the eyelashes, and then it can cause itching, burning, redness, tearing, even vision fluctuations. And then after we treat the patients with this medicine, which is known as Xdemvy here, it literally kills and suffocates and paralyzes these mites that are living in the eyelashes. And then the condition looks a lot better. So this is before, and then this is also before right there, with the Demodex in there, and then here. This is a very advanced condition where you can see the Demodex mites living there. So the Xdemvy is the treatment for this condition, which is 1 drop twice a day for 6 weeks. Now, can you just explain your symptoms, what you felt in your eyelashes to the audience?
Okay, I've noticed that I had a lot of little, like a crust on my eyelashes, and then there's a lot of itching, that goes on there with them. And I've tried, Neutrogena wipes, where I wipe, but then I have a lot of itchiness on both eyes.
Yeah.
And, and I try not to rub, but I mean, it's just they're itching, and I can feel like something goes in my eye, but I can't see it, I can't find it.
Exactly.
And it's hard. But I've never had the symptom before, and it just drives me crazy because sometimes I get a lot of itch in my eyes, and I'm just rubbing and there's nothing.
And so that is a very classic condition. So we have to remember as a doctor, when we're examining the patients behind the slit lamp here, we have to ask them to look down. When they look down, that's when we can see the collarettes. So remember the word collarettes. They are literally stuck onto the eyelashes, and this one is a classic picture where they're literally stuck to the eyelashes. And then when we invert the lid, during the slit lamp exam, we almost always find meibomian gland dysfunction. Those are the glands that are clogged under the lid. So blepharitis, which is inflammation of the eyelashes with the crusting, and then the meibomian gland dysfunction, clogged glands, they almost always go hand in hand, and that's why I'm treating you for both. For her meibomian gland dysfunction, we're treating her with fish oil, omega-3 fatty acid pills, which she already is on. And for Demodex blepharitis, we're going to treat her with Xdemvy 1 drop twice a day for 6 weeks. And we're also going to add these really nice lid scrubs, which are made by OcuSoft. And these are designed for Demodex. So you're going to do these lid scrubs also twice a day. So we're going to do maximum treatment for her. And also remember, these mites, which are Demodex, they do go into the meibomian glands under the lids. That's where they go and go into these deep areas. And at night, that's when their activity is really intense. As you know, when you wake up, you're like, oh my God, what is happening to my eyes, right?
Yes, and then sometimes, I'll just feel like when I rub, all of a sudden I'll get like a tear because I know something's in my eye, but there's nothing that I can't see it.
Exactly. And sometimes, this is very crazy, but during the slit lamp exam, if we angle the beam really good, we can see the mites. We can see the mites. It's a gross look, I'm sorry, but I mean, we have to treat it all. And these mites do live here. These mites are living on our skin, so we don't have to be freaked out, but we just have to treat it with the right treatment plan.
Because I don't even know where I'm.
Exactly. And then some other things that can happen is redness of the eyelids, a little bit swelling, puffiness of the eyelids. Sometimes it can also cause irritation around the eyes. Also, it can be happening with rosacea as well. So there's so much happening with this. And the mechanism of action, as I was reading about it, is GABA channels, and it's the chloride GABA channels that it is working on. So you don't have to know the details, but just for the audience. So we will see her back in about 6 weeks. Any questions?
Not right now.
Very good. See you guys.
Thank you.
Bye-bye.